Good morning. Hey guys, it's Dr. Fulbright here. I wanted to do something new today. I wanted to talk about an article that I read in this journal called Clinical Lactation. There's a subscription that comes out every month, and it's the official journal of the USLCA, which is the U.S. Lactation Consultant Association. Ever since I've been a mom, I've been really interested in breastfeeding and all things lactation. So I wanted to just share some information from the journal that I got this month. So the article I'm going to be talking about is called The Effectiveness of Sleep Training, Fact or Fiction. And this is actually a pretty good article whether you breastfeed or not, but there are special implications for breastfeeding moms. So I'll read the introduction and the results, and then we'll kind of go from there. So the introduction says, in Western cultures, parents often view infant sleep as problematic. Family, friends, and doctors may advise parents to sleep train, assuming it is safe and effective without considering its possible side effects, including its impact on breastfeeding. Unfortunately, it may reduce night feeds and result in earlier supplementation or weaning. The larger question is whether sleep training is worth the risk, i.e., does it improve infant sleep? Our goal was to examine the data on the effectiveness of sleep training interventions on infant toddler sleep. The results, 5 articles were identified that met the criteria for inclusion. Overall, there was no evidence that sleep training improves infant sleep. And then the application for practice, it says the claim that sleep training is effective in changing infant sleep is not warranted. Given the potential side effects on breastfeeding, parents should be cautioned about engaging these behavioral sleep interventions if they have breastfeeding goals they want to achieve. So let's start with just talking about the breastfeeding mom. So the results showed that the different sleep training methods, and it's 2 of them, they showed that neither of them were effective. So first there's the cry it out method, which is basically where parents put their child in the bed, walk out, and they don't re-enter the room for the entire night. And then, so that's by Wise Bluth. Then there is controlled crying or controlled comforting, and that's the Ferber method. That's where parents create a consistent bedtime routine, put the children in their bed, and only return at progressively increasing intervals to comfort the child without picking them up. So basically, you put the baby to bed. If they start crying, you let them cry for maybe 3 minutes. Then you go in, comfort them till they calm down. You leave the room. If they cry again, this time you wait 5 minutes, and then you wait 10 minutes or whatever the interval is. So those are the 2 main methods for sleep training. And in this article, they were actually doing a review of the research that was out there. They only included 5 articles, and the reason is a lot of these articles rely on the parents' self-reports. And so the limitation with that is that it's not 100% accurate. Parents were reporting that their children were sleeping better when they didn't even go check on the child. So if the parent slept all night, then they would say, okay, my child slept all night. When in actuality, maybe the baby got up 3 or 4 times and cried. The parent just didn't hear it or just didn't go answer. So the article, this review only included articles that had some type of objective measure. And there were 2 objective measures, videography or actigraphy. So basically something that was actually looking at the baby to determine if they actually did wake up versus what the parent reported. And the research shows that babies who were sleep trained really didn't sleep any more than those who weren't. And part of that is based on your understanding of sleep. So there's a question of whether sleep is a skill that can be taught. Can it be taught? Can you train a baby to sleep? Or is it a biological process? And in fact, it is a biological process that's regulated by internal circadian rhythms and homeostatic sleep pressure. So basically, babies have this natural sleep-wake cycle. Adults do as well. I mean, We have, REM sleep and all of that, but we don't actually sleep through the night either. So this shows that there wasn't really self-regulation that can be taught, but it's something that comes with age and development. Um, the development of emotion regulation starts to shift from orienting to others. Basically, this happens around age 3 or 4. So, sleep duration naturally lengthens with the development of these systems in babies. So, naturally, these are things that develop at age 3 or 4 with or without sleep training. Now, I get it. I'm a mom of 4. Sleep just gets away from us sometimes, okay? Especially with me having 1-year-old toddlers. So I understand there may be a circumstance where you just have to do something like cry it out, or where you just can't get to the baby every time they're crying because you're doing something. That's understandable. But just understand that doing this consistently as a way to teach the baby is not effective. And in the end, it's not going to improve the amount of time that they sleep. The research just isn't there to support it. So that's just in general, whether you breastfeed or not. But particularly if you do breastfeed, you have to consider that it could slow down or even derail your breastfeeding plan. So if you're breastfeeding and supplementing, that's one thing. But if you are exclusively breastfeeding from the breast or pumping, if you are doing sleep training, it's obviously going to affect your supply. Let's see. Where is it? There is research that has shown there's evidence that breastfeeding infants and toddlers show a different sleep development trajectory with shorter bouts of sleep and more wakings over the first 2 years. So if you're breastfeeding, that's just sleep is just a consequence, a natural consequence of that. Babies who are breastfed naturally wake more at night. There's a lot of theories as to why that is. I've had people that say, well, breast milk is just so thin and it's just not as filling. And actually, if you've ever put breast milk in the refrigerator, you'll see after a while that the fat kind of separates from the rest of it. So it's like a little foam layer at the top. And the fat content actually changes as babies develop. So from your newborn, breastfeeding your newborn baby to, now they're 1 year old, now they're 2 years old. As they develop, the content of the breast milk changes. And so one interesting thing that I share with caregivers, the amount of breast milk or the amount of milk that you give a breastfed baby, it doesn't change over that first year. You notice with, the bottles that you can buy, they start with the little 5-ounce bottles, then it's the huge bottles. That change happens with formula fed, but with breastfed babies, the amount of milk that they need doesn't change. It's usually 1 to 1.5 ounces per hour. And that formula doesn't change as they age because the content of the breast milk changes. Now, I digress, but I say all that to say, naturally, breastfed babies, they wake up more at night, not because, the breast milk is not filling, it's watery, it's not nutritious enough, just that's just the trajectory for breastfed babies. So just something to consider if you have a newborn or a toddler or a 2-year-old, whatever, and you're still breastfeeding. Just know that it's going to get better, maybe around age 3 or 4. But it's not worth your breastfeeding relationship to try to do sleep training because the research shows that it's not effective, not more effective than not doing any type of sleep training at all. I think there was one other thing I wanted to mention. Oh, I did mention this about how parents overestimate their child's sleep, especially if the parent is neither co-sleeping nor breastfeeding. And that's why it was important in this study for them to find articles where objective measures of sleep were used as opposed to parent reports. So anyway, I think you guys get the idea. The bottom line is that sleep training, the effectiveness is really fiction. The research is just not there to show that with the cry it out or the controlled crying method, babies end up sleeping more. And then, especially if you're breastfeeding, I mean, it's all about supply and demand. And I know a lot of breastfeeding mothers at some point or another in their breastfeeding journey, they feel like their baby's not getting enough. And it's all about supply and demand. You can do the galactagogues, you can try the mother's milk tea, you can try the, oatmeal, all these different concoctions they come up with. But in the end, it's supply and demand. And so if your baby wakes up 2 or 3 times in the middle of the night and you're doing the cry it out method, basically where you're not going in there to feed them, that's a whole 6, 8, 10-hour period where you're not emptying the milk from your breasts. And so that's going to signal to your body that that's 8 hours where you don't need to produce milk. And so that's how sleep training can negatively impact your breastfeeding journey. If you're going a long period of time where you're not breastfeeding and you're not pumping, then that's going to obviously decrease the amount of milk that you have. So sleep training, if you're formula feeding, not that effective. Sleep training, if you're breastfeeding, is not effective, but then also it's going to be detrimental. But I'm a mom, so I understand that there are some nights where we just can't get to the baby, or for our own mental health and our own exhaustion, we have to get that rest. Perfectly fine, but just know it's not a good long-term strategy. Okay? All right, that's all I got. So any questions, comments, you want to argue, whatever, let's go. All right, have a good day.